Okay, class, as we move on, now we're going to go into the urinary system. Now, the terms are going to get harder. There's a lot of terms to memorize, unfortunately. So, we just keep plugging along. Alright, so the goals of this chapter are name the essential organs of the urinary system and describe their locations and functions. Identify some common pathological conditions. Recognize how urinalysis is used to interpret as a diagnostic test, and define urinary system related combining forms, prefixes, and suffixes. Again, this is a medical terminology class. I must stress that I'm not really interested in that you know the physiology of how urine is made or some of the conditions, but you do need to know a little bit of the background of a little anatomy just so that you understand the words. So list and explain clinical procedures, laboratory tests, and abbreviations that pertain to the urinary system. Alright, so there's nitrogenous wastes, which is urea, creatinine, and uric acid. So what you got to ask is, why is this nitrogenous waste excreted from the body? Alright, and what's the medium does urea travel to the kidneys from, or how is urine made? Okay, so those are some of the kind of things. Again, this is nitrogenous waste that your body makes, so you're going to try to get rid of this urea, creatinine, and uric acid. Okay, now what's the functions of the kidneys? Well, they filter nitrogenous waste to form urine. There's about 200 quarts of blood that are filtered every single day to form 2 quarts of urine. Kidneys are designed to maintain proper balance of water, electrolytes, sodium, potassium, and acids. The kidneys also release hormones, and they release renin, which is an enzyme important in adjusting blood pressure. You've heard of EPO when you heard of Lance Armstrong, and that's what he supplemented with. But EPO is a hormone that stimulates red blood cell production in the bone marrow. As you go into higher altitudes, your body will start to make more EPO so that it can have the demands of the less oxygen in the air. Okay. So if you ever go snowboarding or skiing, you realize that, it's a little difficult to breathe. So what will happen is your body's going to have to compensate. Now, also is to degrade and eliminate hormones from the bloodstream. So the kidneys also adjust the amount of water and electrolytes for proper muscle and nerve function. Now you hear these scams of, liver cleanses and kidney cleanses and all that. You don't need any of that stuff because your body is designed to filter all those wastes out. Your body is designed to detox your body. Okay, so the kidneys and livers do a great job. You don't need any special drinks, special supplementation, or anything like that. So don't fall for those scams. So what's the organs of the male urinary system? Well, you got 2 kidneys, a ureter, urinary bladder, and a urethra. Okay. So here we go. Here's the major organs. Now you have 2 kidneys. The right one sits slightly lower than the left. But you probably, just for kicks and giggles, you might want to know what's the size of a normal kidney, what's the function of the ureters, what's the function performed by the urinary bladder, the urethra. Okay. Now, I won't quiz you on that because that's more anatomy and physiology, but it's always nice to know a little bit about these. Okay, so you have 2 kidneys, you have 2 ureters that empty into the urinary bladder, and then you have the urethra. Now, the male urethra is going to be longer than the female urethra, okay, just from an anatomical standpoint. Now, organs of the female, you still have 2 kidneys, ureter, urinary bladder, and urethra. So really, from a male to female standpoint, the urinary system looks exactly the same, only the size of the urethra in females is a lot shorter. So unfortunately, they'll be more prone to urinary tract infections. Okay, but the kidneys are the same, the ureter is the same, and the bladder is there. Okay. Now, the other thing that's a little bit different from male-female is you can see that the males, they share a common opening with the reproductive system. So the urinary system and the reproductive system is the same opening, whereas in females, you have 2 separate openings. You have a opening for the urinary system and you have an opening for the reproductive system, whereas males, they share a common opening. Okay, what is voiding? Is it nitrogenous waste? No. Is it urination? Is it outer section of the kidney, or is it triangular? So voiding means urination. So the correct answer is B. How kidneys produce urine. Now again, this is high-tech physiology. Probably won't ask you the details of this, but you need to just know the words. So blood enters the kidneys through the right and left renal arteries. Okay. Arterioles carry blood to the capillaries, and the glomeruli are what filter the blood. So imagine you've seen those cheese graters, right? And they have these special holes in it. What happens is if you push enough substance through that, most of the substance will stay, but the excess will get filtered. So think of glomeruli like that. They push the blood through there. Anything that's excess will be squeezed out there, such as nitrogenous waste, urea, uric acid. It depends on the size as well. So there's approximately 1 million glomeruli in each cortex of the kidney. And kidneys help regulate blood pressure. They maintain blood pressure. So there's a lot of things that the kidneys do that you'll find out in anatomy and physiology. Now, if you look at this, how kidneys produce urine, again, so here's the renal artery. Blood enters the kidneys through the right and left renal arteries. Arterioles carry blood to the capillaries, and the glomeruli, which are up here, will filter the blood. Now you have two kidneys, but really if you were to donate one kidney, the other kidney would actually grow in size to compensate for the loss of one kidney. So really you can easily survive with just one kidney. And really, even if you lose half of that function of that one kidney, you still be fine. So really you have two kidneys, but you really only need about 50-60% of one to okay, so yeah, there's a lot of room for error. Now the glomerulus and the Bowman's capsule, blood enters through the glomeruli. Now the glomerular or the Bowman capsule surrounds each of the glomerulus, and the renal tubule is attached to each Bowman capsule. Again, if you wanted to kind of go on YouTube and see, just type in how urine is formed. There's a good videos on that. Again, I'm not going to quiz you on that because that would be physiology and anatomy. I just need you to learn the terminology. Glomerulus and glomerular Bowman's capsule. So again, blood enters here. Now again, the arterial, afferent arterial is thicker, and this one is thinner. So what happens is when you have a lot of pressure going in here, the sugar, the water, urea waste, and the salts are going to get squeezed out because it's exiting through a smaller opening, right? So it's like if you were to squeeze something out, like a tube, like imagine a toothpaste, or if the opening is real narrow, some of it's going to get filtered out, and that's what happens. Is sugar, water, urea, and waste get filtered out. So there's 3 steps in the formation of urine. You have glomerular filtration, which will get rid of the water, sugar, waste, salts. You have tubular reabsorption, which will, let's say the body says, you know what, I don't want to get rid of all this water. I don't need to get rid of all this sugar and sodium. So it'll take back what it needs, and then it will secrete some acids, potassiums, and drugs if it needs to get rid of it. Now here's an interesting little fun fact. Again, you excrete the pharmaceutical drugs that you take in. They did a study in Orange County, and they found that the 3 most commonly excreted drugs from the urine that are found in the sewer system of Orange County were antidepressants, pain medications, and Viagra. So it tells you Orange County in a nutshell. A bunch of pain addicts, they need antidepressants, and they need Viagra. So again, you excrete minute amounts of those pharmaceutical drugs in your pee. So that's why you don't drink tap water. Okay. All right. So how kidneys produce urine? Again, here's the arterial, which is thicker, and the efferent is tinier, and there's the secretion, glomerular filtration, tubular reabsorption, and then tubular secretion. So it says, okay, I want to take up the water, sugar, salts, but some tube says, okay, let's get rid of the acids and the potassium and those drugs. So it'll be secreted as urine. So this is the first step, then there's a second step, and then there's the third step. The glomerulus and the renal tubule combine to form a unit called the nephron. Okay, so there's the glomerulus. There's descending loop of Henle, ascending loop of Henle. Now, diuretics work in this way. Okay, so they will affect the absorption of sodium or potassium and affect blood pressure, and diuretics work in this area right here. Again, not a physiology class, so you don't need to know how that works, or otherwise I'd spend a lot of time on it, but from a medical terminology standpoint, just need to know the words in general. Approximately how many nephrons are there in a kidney? There's 1 million. Now, anything on here is fair game. I may ask this, but I probably won't. Right? Again, in medical terminology, I'll stick with what the words mean. All collecting tubules lead to the renal pelvis. So there's calyces. There are small cup-like regions of the renal pelvis. Their term comes from the Greek calyx, meaning a cup or case surrounding a flower bud. Okay. Again, the functions of the kidneys is to remove nitrogenous waste, balance water and electrolytes, release hormones, and degrade and eliminate hormones. So here's the bloodstream, goes into the glomerulus. It filters the water, the sugar, the salts, the urea, glomerular capsule, and the renal tubule. So it says, okay, we need to go keep these water, sugar, and salts. We'll reabsorb it and go back into the bloodstream. But then it says, okay, the tube says we need to get rid of more acids, potassium, and drugs. We're going to get rid of it. Once it goes into the renal tubule, it pretty much, the urine is formed, and urine is a combination of mostly water, but it has acids and drugs, has salts, and urea as waste. Okay. Now the common misnomer is if somebody gets stung by a jellyfish, should you pee on it? Unfortunately, as you filter out, yes, the ammonia would work, but by the time it reaches out, there's not enough concentration of urea or uric acid to actually make a difference. So, contrary to what Friends tells you, it won't work. Okay. Now, before you go on to the terminology, what does your urine say about you? Well, if it's no color transparent, and people think that having clear urine is healthy, but actually if your urine is clear, then you're drinking a lot of water and you may want to cut back. So it shouldn't be completely clear. It should actually be I like to call it the light lemonade or a pale straw color. You're normal, healthy, and well hydrated. Again, if it's transparent yellow, that's normal. If it's dark yellow, it's starting to get concerned because you probably are on the verge of getting dehydrated. So drink a little bit more water. Okay, so we don't want it to be dark yellow. You probably notice that first thing in the morning when you wake up, it's dark yellow because, well, you haven't drank any water for about 8 hours. If it's amber or honey, your body isn't getting enough water, so drink at least a couple glasses. If it's brown or syrupy, you would have liver disease or severe dehydration. Drink lots of water and call your doctor if it persists. If it's pink or reddish, either you've eaten too much beets or too much blueberries or even rhubarb. If not, you may have blood in your urine, and this could be a sign of lots of things: kidney disease, tumors, prostate problems, or even UTIs. If it's orange, you may not be drinking enough water, or you could have a liver or bile duct condition. If it's blue or green, yes, some of it can be blue or green. It's a rare genetic disease that can turn your urine blue or green. So also there's certain bacteria that can cause this infection. Maybe food dye in something you ate or a medication. If you drink a lot of Red Bull, if you drink a lot of Rockstar, if you take a lot of B vitamins, it can be that neon green color. What if your urine's purple? Don't worry, there's no such thing. Just threw that in there. And what if it's foamy or fizzy? Well, it's a harmless hydraulic effect because you've been holding it for a while, but it could show signs of excess protein in your diet if it consistently persists. But if it's just one time, then it's no big deal. But if you see it continually be fizzy, you probably want to get that checked out. All right, now let's go into the words. So we're going to go arteriole, calyx, okay, catheter, cortex, creatinine, electrolyte, So what's an arteriole? That's a small artery. A calyx is a cup-like collecting region of the renal pelvis. The term comes from the Greek calyx, meaning a cup or case surrounding a flower bud. Catheter, a tube for injecting or removing fluid. So when you put a catheter in, it's to help go to the bathroom. Okay. Cortex, outer region of an organ. Creatinine, nitrogenous waste excreted in urine. You've probably heard of creatinine phosphate, but that's creatine phosphate. Okay. Electrolytes are a chemical element that carries an electrical charge when dissolved in water, so sodium, potassium are electrolytes. Erythropoietin, EPO, filtration, glomerular capsule, glomerulus, and the hilum. So EPO is a hormone secreted by the kidney to stimulate production of red blood cells by bone marrow. Poietin means a substance that forms. Okay, remember Lance Armstrong, he used to inject himself with EPO. Filtration, process whereby some substance passed through a filter. Glomerular capsule, enclosing structure surrounding each glomerulus, also called the Bowman capsule. Glomerulus is a tiny ball of capillaries in the kidney. This is the functional unit here. Functional unit is nephron, but the glomerulus is what will help filtrate the blood. The hilum is a depression in the part of the organ where blood vessels and nerves enter. So there's a hilum in lungs as well. Comes from the Latin word meaning a small thing. Kidneys, a meatus, medulla, and a nephron. So again, the nephron is the functional unit of kidney where filtration, reabsorption, and secretion take place. And that includes the glomerulus. Kidney is one of two bean-shaped organs that filter nitrogenous waste from the bloodstream to form urine. Meatus is an opening or canal. Medulla is an inner region of an organ. The term comes from the Latin word medulla, meaning marrow. Nitrogenous waste, potassium, reabsorption in the renal artery. Nitrogenous waste is substance containing nitrogen and excreted in urine. That's urea, uric acid, and creatinine. Potassium, an electrolyte regulated by the kidney. Reabsorption, renal tubules return materials necessary to the body back into the bloodstream. And the renal artery is blood vessel that carries blood to the kidney. You have a renal pelvis, renal tubules, and the renal vein. Renal pelvis is the central collection region in the kidney. Renal tubules are microscopic tubes in the kidney where urine is formed after filtration. The renal vein is blood vessel that carries blood away from the kidney. Renin, sodium, trizone, and urea. Renin is an enzyme secreted by kidney that raises blood pressure. So blood pressure medications will help control this. Sodium, another electrolyte regulating the blood and urine by the kidneys. A common form of sodium is sodium chloride, which is table salt. Trizone is the triangular area in the urinary bladder. And urea is major nitrogenous waste secreted in urine. Here's a ureter, urethra, uric acid, urinary bladder, and urination, which is voiding. So ureter means one of the two tubes leading from the kidneys to the urinary bladder. Urethra, tube leading from the urinary bladder to the outside of the body. Remember, in males it's longer than in females. That's why females are more prone to UTIs. Uric acid, nitrogenous waste product excreted in the urine. Urinary bladder, which is the hollow muscular sac that holds and stores urine. You can hold about 500 cc's of urine before your body says, oh, you better go to the bathroom. And then urination is voiding, which is the process of expelling urine, also called micturition. So urination and micturition is the common word.